Redirection of T cells has become one of the most important treatment strategies for hematologic malignancies. And in our abstract, we focus on two of the main immunotherapeutic approaches, which consist of T cell redirection via chimeric antigen receptors, short CAR, or T cell redirection via bispecific T cell engaging molecules, also known as BiTE. So in our previous studies, we already showed that FLT3 is a suitable target antigen for AML. And now we compare FLT3 CAR-T cells with the FLT3-directed BiTE molecule in a preclinical AML model. So first we wanted to test our constructs in co-cultures with AML cell lines. For this we used cell lines with different genetic background and also different FLT3 expression levels. And we could see that both constructs lead to comparable specific lysis of the target antigen expressing cells, whereas the lysis of the target antigen negative cells were similarly low. Now, of course, we wanted to test the constructs also in co-cultures with primary AML cells. And again, we could see that the lysis is comparable, and we tested this in an allogeneic as well as an autologous setting. So in further studies, we could show that the expression of the co-stimulatory molecule CD86 enhances the BiTE-mediated lysis, but the cytotoxicity of CAR-T cells was not affected. And it is also already known in literature that there are pronounced differences in synapse formation between BiTE and CAR-redirected T cells and their target cells. And we could also confirm that in our experiments. So we saw that conjugate formation as well as subsequent degranulation are significantly stronger and faster by CAR-T cells compared to BiTE T cells. Now, we also wanted to see if we can enhance the cytotoxicity of our constructs by potential combinatorial treatments. And we could show that combination with the PD-1 checkpoint blocking molecule Nivolumab slightly enhanced the cytotoxicity of CAR and BiTE, but this effect was even more pronounced when we added FLT3 tyrosine kinase inhibition to co-cultures with FLT3 ITD mutated AML cells. So now, in contrast to our in vitro data, using a xenograft in vivo AML mouse model, CAR-T treated mice had a significantly prolonged overall survival compared to the BiTE treated group. Taken together, our data underline the power of both T-cell-based immunotherapy platforms for the treatment of myeloid malignancies, but of course there are future studies needed to dissect the impact of BiTE and CAR treatment on T-cell function and how this then translates into response and outcome.